Hello.
My name's Casey. I'll be your licensed veterinary technician today.
Nice to
Hi,
meet you.
Drakey. How are you, sweet boy? I hear you're not feeling too good. Oh, it's okay. It's okay. We're going to make you feel better, Blueface. Yes, we are. Yes. Okay, so I see we are a new patient and a new client. We received all of your medical history from your previous clinic already.
Okay.
So I was going through the motions of reviewing all of the content. So I'm going to ask you a few questions about that, as well as we're going to chit chat a little bit about Drake's history and the reason for his visit.
Okay.
So I see Mr. Drakey is here for vomiting concerns. When do we feel like our vomiting began?
Probably about 3 days ago.
2 days ago? Okay. And about how many times per day do you feel like he's been vomiting?
The first day, it was about 4 to 5, and then it slowly tapered off since then.
Oh, good.
However,
Okay.
it's still a cause for concern for me.
Okay. Now, each time that he vomited, did it appear to look the same as the time before in its color and its consistency? So it's like thickness. Was it very liquidy? Was it clear? Was there foam present? Those types of things.
The first day, it was pretty foamy and yellowy. And then I guess as he's been drinking more water, it's just been more clear and kind of like saliva-ish.
Okay. That's good. Now, how has his appetite been through this complication?
He eats anything and everything I put in front of him. So there's
Even-
been no problem with appetite.
Even with vomiting, he's going to have
Oh
the
yeah.
desire to eat.
Oh yeah. And
That's a
I
positive.
and I haven't noticed him vomiting up his food, so I don't know
Okay.
why he's not, but he's
So-
keeping it down.
So then if he's able to eat and he hasn't been vomiting, potentially as a result of that, from what we'll chat about, what do you feel like could have been triggering his vomiting, if anything? Any ideas?
I'm not
Anything
sure.
he has a tendency to get into? Does he like to go trash can hunting? Does he like to steal things off the counter, go into the bathrooms, go into your bags and pull things out like he shouldn't?
Yes, he is a huge lover of toilet paper and toilet paper rolls. But with this everything going on now, I have been very, very keeping an eye on him to where he doesn't get into the toilet paper because of the issues going on right now. So I know that is not the cause. I do have other dogs in my home, and they are on separate foods. So he is one to continue to eat, and if a dog walks away, he will finish out their bowl. So that's probably something to think about.
That makes sense.
But as of anything else, counter surfing or anything like that, I don't notice that he does that.
Okay, that's a plus.
And he does not eat people food, so
Good.
no table food, no table scraps.
What
So,
types of treats then would you feed him whenever you choose to do so?
I give him one every morning before he goes into his house, and then at night before we go to bed, and it's just the pedigree little marrow bones.
Okay.
Little bitty bite-sized pieces.
So mentioning that you have unique diet setups in your home, what type of diet do you currently feed him?
He is on Hill's Science Diet, adult, age 1 to 6. I think it's chicken flavor, and yeah, that's what he gets. And then he gets boiled chicken as well.
Oh, delicious. Is it boiled chicken without the seasoning?
Oh, no seasoning at all.
Good.
Just bland.
Good. Bland boiled chicken. That's what we want
Yeah,
if that's
yeah.
offered.
Yeah.
Okay. And about how much and how often per day are you feeding?
They eat at morning, night. They're on a strict schedule, 5 a.m., 5 p.m. And he gets 2 cups in the morning and 2 cups in the afternoon, or in the evening for the meal. So 4 cups daily. Plus about a quarter cup of chicken each time.
Okay, that was my next question. Good. Good deal. And what type of flea and heartworm preventative is he currently on?
He is on the ProHeart yearly injection.
ProHeart 12.
Yes. And as far as fleas, we've been very lucky that we don't have a flea issue in our home, so he's currently not on anything
Good.
at the moment.
Okay. Going into summer, we know that may have to change, potentially, if it arises.
Yes.
Okay,
So
so
not.
when the time comes, if it does,
Mhm.
you can always call up and ask us questions about flea preventatives. There are benefits to having prescription ones versus over-the-counter products.
Mm.
Not that over-the-counter products won't necessarily be beneficial, but we aim for the best in
Yeah.
medicine, and the best typically is prescription for a variety of reasons. So just let us know if you have questions, if that time comes. Let's see, and I see that from his previous clinic notations that he is on an antibiotic called doxycycline.
Yes.
200 milligrams, and you have been administering 1 tablet twice daily for 10 days.
Correct.
For treatment of a respiratory infection.
Yes.
And it began about 5 days ago. So how do we feel like we've been doing with respiratory infection treatment?
I have noticed a significant difference, and I'm pretty sure he's on the downward slope of it. So, all better. Getting better.
Good boy. We don't want you to have respiratory infections. Now, with that being said, you have other pets in the home. So, whenever you began this medication, when he was previously diagnosed with a respiratory infection, did you separate your pets, or were they able to play together? Because these typically are very easily to transmit amongst other dogs.
I've never been asked that before, so I wasn't told not to do that. But yes, they all play together. They house next to each other.
Okay.
So,
sometimes it can be transmitted to the others. It's relatively common to see, and sometimes it's not. Kind of like if I have a cold and I'm around you a whole lot, I could potentially give you the cold too by touching certain things you touch, vice versa. Yeah,
definitely makes sense.
How have the other dogs been then?
I haven't noticed anything
Good.
wrong with them. So,
Okay.
yeah.
Keep a close eye. If you feel like they are potentially starting to show similar symptoms, a little bit of lethargy, so a little tired, maybe they don't have that great of an appetite, if they have iron or nasal discharge, coughing, sneezing, of course, comes into play, let us know.
Okay.
We're going to definitely need to check them out.
Okay.
And then for him, has he had any diarrhea potentially as well?
Not that I've noticed, no.
Okay. And then his coughing and sneezing has improved with his doxycycline, as you've mentioned.
Mm-hmm.
Good. Okay. Well, also looking at his history, I see that his vaccines, his blood work, so check in internal organ function, how his red blood cells, white blood cells are looking, all that good stuff as well, is currently up to date. His Heartburn test is up to date. So we're good on all of that for his preventive care visits. So in the future, he's going to be doing about 6 months.
Okay.
So you are good until then, as well as you have the lucky ProHeart 6 or ProHeart 12 coverage for the year.
Perfect product.
Lucky guy.
Beautiful product.
I'm going to have to look into that. I haven't gotten it yet. My boys are on different things, and that's okay.
Ugh, it makes life so simple. Really does.
All right. So your doctor will be in just a moment. We're going to get Drake's vitals in here together. Since you're a new client, it's going to be something I can do at the same time as the doctor talks to you to be able to let that person be able to be more involved during your first visit, and we're more than happy to answer any questions you may have. All right, so he'll be in just a minute, handsome face. Don't eat any treats.